Hello everyone, this is Teacher Rosabel Albudra of Emilio A. Bondok High School. Today, I'll be talking to you about blood pressure and how to measure it. Here are the learning objectives. You will be able to define blood pressure, including the difference between systolic and diastolic pressure, Korotkoff sounds and auscultatory gap, define hypertension and hypotension, and demonstrate proper technique in taking blood pressure. To begin with, let us define blood pressure. What is blood pressure? Blood pressure is a lateral pressure exerted by flowing blood on the walls of the arteries. It is one most important physiological parameter of the body, which is why it included the 5 vital signs. We have the blood pressure, temperature, heart rate, oxygen saturation, and respiratory rate. When you take the client's blood pressure, you are measuring the force of the blood flowing through the arteries. There is always a certain amount of pressure in the arteries. This is because the heart, by pumping, is constantly forcing blood to circulate. The amount of pressure in the arteries depends on two things: the rate of heartbeat and how easily the blood flows through the blood vessels. The heart contracts as it pumps the blood into the arteries. When the heart is contracting, the pressure is highest. The pressure is called systolic pressure. As the heart relaxes between each contraction, the pressure goes down. When the heart is most relaxed, the pressure is lowest. This pressure is called the diastolic pressure. Before we are going to proceed in actual procedure in taking blood pressure, we have two phenomena that you need to be aware: the Korotkoff sounds and the auscultatory gap. Korotkoff sounds. It is a rhythmic noises heard in an artery that is being partially compressed by a blood pressure cuff. It occurs such compressive pressure between the person's systolic and diastolic pressures. Phases are characteristic of Korotkoff sound. In phase 1, you will hear a sharp thud. These are the first sound heard as the valve pressure is released. These sounds provide the systolic pressure reading. In phase 2, a blowing or swishing sound. Swishing sound as blood flows at the blood vessel as the cuff is deflated. In phase 3, a softer thud than phase 1. It is an intense thumping sound. Phase 4, a softer blowing sound that disappears. Softer and muffled sound as cuff pressure is released. The change of sound over phase 3 to the muffled sound of phase 4 is known as the first diastolic reading. And the last phase, phase 5, silence. Silence that occurs when the cuff pressure is released, enough to allow normal blood flow. This is known as the second diastolic reading. Auscultatory gap. It is also known as a silent gap. It is a period of diminished or absent of Korotkoff sounds during the manual measurement of blood pressure. It is associated with reduced peripheral blood flow caused by changes in the pulse wave. In severely hypertensive, after first appearance of sound, occasionally it disappears near to the point of 200 mm of mercury and appears in a range around 20 to 50 mm of mercury, and later finally disappear at the point of diastolic blood pressure. Now let's take an example. This is an actual blood pressure when sounds appear at the level of 230 mm of mercury. And at 200 mm of mercury, sounds disappear. and the sounds appear again at the level of 160 mm of mercury, and at 100 mm of mercury, the sounds finally disappear. This portion is known as silent gap. The silent gap or auscultatory gap is important because a failure to recognize gap can result in underestimation of the systolic pressure and or an overestimation of the diastolic pressure. The normal blood pressure is less than 120/80 or 120/80. When a person's blood pressure is higher than the normal range of its age and condition, that is hypertension. Hypertension is also defined as systolic blood pressure at or greater than 140 mm of mercury and or diastolic blood pressure at or greater than 90 mm of mercury, averaged over 2 readings as measured at each of 2 or more separate clinic visits. In addition, hypertension should not be first diagnosed in the setting of active illness unless severe or there is end organ damage consistent with chronically poorly controlled hypertension. I now move on to the classification of hypertension, complementary approaches on how can be classified. If the systolic blood pressure is under 120 and diastolic blood pressure is under 80, the patient pressure is considered to be normal. The patient is considered to have pre-hypertension if the systolic blood pressure is 120 to 129 and diastolic blood pressure is 80 to 89. This is the borderline category which can be used to convince patients to embark on lifestyle changes, including maintaining a diet low in sodium, exercising regularly, limiting caffeine consumption, or quit smoking, and less drinking alcohol in order to reduce hypertension category. Hypertension category is divided into 2 stages. In stage 1, the systolic blood pressure is 140 to 159 and diastolic blood pressure of 90 to 99. In stage 2, systolic blood pressure of 160 and diastolic blood pressure of 100. If the patient has a blood pressure of 170/100, it will be considered in stage 2. This classification is easy to use because it is completely objective. You have to remember that there are patients because of some medical problems like heart failure, their blood pressure is 120/80, might be high and require treatment. Or for some, the normal blood pressure is normal for them but may be high for others. One high reading does not mean you have hypertension. It requires a minimum of 2 or 3 elevated readings to confirm that has a condition. Here are the risk factors for hypertension: obesity, smoking or vape nicotine, eating too much processed foods and salt, excessive alcohol intake, and sedentary lifestyle. Among the risk factors mentioned, obesity is the single most important. Let's talk about hypotension. Hypotension is a condition whereby the arterial blood pressure is abnormally low, and when the blood pressure is lower than the normal range for his age and condition. A blood pressure reading lower than the normal 90 systolic blood pressure and 60 for diastolic blood pressure is considered as hypotension or low blood pressure. Here are the following conditions that cause hypotension. First, health problems. Health or in some conditions like heart failure or heart attack can lead to low blood pressure. Next, we have dehydration. Dehydration is when the body loses more water than it takes in, which can cause weakness, dizziness, and tiredness. Vomiting, severe diarrhea, and fever can also lead to dehydration. Lack of nutrient in diet. Nutrients like folate and vitamin B12 can keep your body from producing red blood cells, causing low blood pressure. And last, we have pregnancy. During pregnancy, circulatory system expands rapidly, which is why to make blood pressure drop. Treatments of hypotension depend on its causes. For further treatment and medication, one should consult and visit a doctor. Here are some treatments of hypotension. First, adding electrolytes to a diet can cause relief symptoms of mild hypotension. Electrolytes are minerals that carry an electrical charge. They're vital for health and survival. Good sources of these are dairy milk, yogurt, banana, watermelon, as well as the avocado. A morning dose of caffeine can also be effective, and lying on the back and lifting the legs increase venous return, making more blood available to critic. Venous return is the flow of blood back to the heart. Talk about the equipment in taking blood pressure. First, we have the stethoscope. Stethoscope is an instrument for listening to the action of someone's heart or breathing, and it allows you to hear your heartbeat and your blood flow. Here are the parts. We have the binaural, the tubing, which is responsible for transferring and relaying the frequencies of sounds picked up by the chest piece. This is the bell, or round side of the drum, is better to hearing low-pitched sounds. The diaphragm, or flat side of the drum, is better for hearing medium or high-pitched sounds, and of course we have the ear tip. Another equipment is the sphygmomanometer. Sphygmomanometer is an apparatus for measuring blood pressure. We have the parts of the sphygmomanometer. This is the cuff. A cuff holds the bladder around the arm during the measurement. This is the tube, the sphygmomanometer. We also have the bulb used to pump the air to the cuff. This is the valve. It plays a vital role in getting accurate measurement, and of course we have the manometer. Manometer used to measure the air pressure in millimeter of mercury. Sphygmomanometer is a combination of three Greek words. Sphygmo meaning pulse, mano meaning pressure, and meter meaning measure. Sphygmomanometer have different types. We have the aneroid sphygmomanometers, mercury sphygmomanometers, and digital sphygmomanometer. The one that we are going to use later on is the aneroid sphygmomanometer. Depending on your equipment, the gauge can be mounted on the wall, attached on small rolling stand, or small enough to hook directly on the cuff itself. Regarding the best timing to when blood pressure is measured, keep in mind that the blood pressure varies throughout the day, and it can be temporarily affected by exercise or caffeine consumption within the prior of 30 minutes. For patients taking antihypertensive medication, it's preferable to measure the blood pressure immediately before the medicines are usually taken, or in some specific situations, it is also measured after they take some medicine. For example, the patient is complaining for severe headache, which could be for the reason of excessive medication. So now, what is the actual procedure in taking blood pressure? First, this is omitted in practice. It is recommended that the patient first empty his or her bladder, as full bladder may elevate the pressure. Next, the patient should be resting in a quiet room for at least 5 minutes. You should also assemble your equipment like the stethoscope and the aneroid sphygmomanometer. Wash your hands and sanitize. After doing this, you can start or you can begin in taking blood pressure. Taking blood pressure. First, you have to ensure arm is at the level of the heart, resting comfortably. In positioning the blood pressure cuff, first, you have to locate the brachial artery. Use your 2-finger or your index and middle finger over inside the center of your inner elbow, or it can be found on the elbow's front side. When you press lightly, you should be able to feel the pulse of your brachial artery. If you have difficulty locating the pulse, place the head of the stethoscope or the diaphragm in the same general area until you can hear the heartbeat. is you have to place a blood pressure cuff around the brachial artery. The client's arm should be bare up to the shoulder, or the client's sleeve should be well above the elbow. Wrap the cuff snugly and smoothly around the client's arm above the elbow. But do not wrap it so tightly that the client is uncomfortable from the pressure. Leave the area clear where you will place the bell or diaphragm of the stethoscope. You have to make sure that the cuff fits the patient. To check the cuff size, slide your two fingers underneath the cuff and make sure that it's not too tight or not too loose. Because if you are going to use the blood pressure cuff that does not fit, you can get inaccurate reading. Next procedure is you have to find the radial pulse to estimate the systolic palpation by palpatory method. You can find the radial pulse in groove of wrist on thumb or right below the thumb. Use your index and middle finger to feel the pulse. Turn the valve clockwise to close it. Inflate the valve until you no longer feel the radial pulse. Deflate the valve counterclockwise. Take the number and add 30 mm of mercury. That's where you are going to inflate the cuff when you are taking blood pressure. Hold the stethoscope. Put the ear tips into your ears. Twist this and tap the diaphragm to check for the noise. Place the diaphragm in brachial artery. Tighten the screw of the valve to close it. Turn it clockwise. Inflate the cuff until the dial points to 30 mm of mercury above the radial pulse. Slowly deflate the valve to 2 to 3 mm of mercury per second and listen for the first beat, that is your systolic. And record the last beat of blood flow, that is diastolic. And then deflate the cuff completely. Let's take a look on it. That is the first beat, which is the systolic. It falls in 1/10, and the last beat for 70 mm of mercury. The blood pressure is 110/70. Next to the procedure is you have to remove the cuff to your patient. And then after that, record your findings in the patient's note. Tell your patient about their blood pressure reading. One reading is insufficient to diagnose health, hypertension, or hypotension. If you are unable to identify either systolic or diastolic pressures, wait at least 15 seconds before doing another reading. Here are the factors that influence blood pressure. It includes temperature of the environment, exercise, physical activities, pain, alcohol intake, smoking or use of tobacco, certain drugs, physiological factors, and nutrition. Remember not to take blood pressure in an injured arm, an arm with a cast, a lymph node removal or mastectomy, an arm with IV or intravenous present. An IV is used for patients who need to receive the medication immediately. Do not take blood pressure on the arm that has IV because the pressure cuff may dislodge the cannula or it can cause the cannula to be out of vein. It can also cause further bleeding on this site. A cannula is a thin tube inserted into a vein of body cavity to administer medicine, drain of fluid, or insert a surgical instrument. Maintaining a healthy blood pressure is very important because the lower or higher blood pressure is, the higher your chances of having health issues are. This is the end of my presentation. I hope you found it to be helpful.